Mrs. Tremblay had a stroke several years ago. Since, she has been living in long-term care due to extremely limited abilities. She has a special diet and needs significant assistance to eat. This is your first shift in this ward, and you are tasked with helping Mrs. Tremblay during her meal. Mrs. Tremblay cannot speak and has difficulty understanding instructions. The PSW checks the user's feeding needs in the intervention plan or attendance handbook. The user has total disability and requires full assistance when taking meals. Her diet also includes thickened liquids. Check if the textures on the tray correspond to the user's intervention plan. Hand hygiene helps to eliminate microorganisms.
Good morning, Mrs. Tremblay. My name is Cynthia. I'll be helping you with your meal, today. Okay. Is that good with you?
Yeah.
You're ready? Perfect.
The PSW introduces herself and checks the user's ID. She tells her what she is about to do with short, simple sentences. She asks questions that can be answered by yes or no or head movements, as she has difficulty expressing herself.
We'll be putting your glasses on since you already have your dentures on, okay?
Yeah.
Make sure the user is wearing her dentures, hearing aids, and glasses. To help with eating, the PSW installs the user in seating position as upright as possible and not leaning back, as this increases the risk of choking. There are various ways to assist a person with eating: seating at the same level as the user and introducing small bites of food on the lower lip first, for example. The use of straws is not recommended.
We'll just be giving your hands a hand wash, okay? And then we'll be ready to get you to eat soon. Okay.
The PSW washes her hands again with hydroalcoholic solution before she starts preparing the food. She also washes the user's hands with a soapy washcloth. The PSW makes sure the food is appropriately prepared according to the user's limitations. Placing the utensils on the functional side of someone with paralysis, or naming the position of the items on the tray for visually impaired users are two examples of adaptive assistance. In this case, the PSW makes sure the liquids are thickened and that the food are pureed. Thickened liquids are easier to swallow, which reduces the risk of choking. Dysphagia is generally a permanent outcome for people having suffered a stroke. The PSW must follow the prescribed diet to prevent any negative impacts on the user's health. The PSW helps the user with eating.
For lunch, we've got some mashed potatoes, some beef, and some green beans. I think you like that, Mrs. Tremblay, right? Perfect.
Yeah.
So I'll be giving you your first spoonful, okay?
Okay.
The PSW feeds the user one bite at a time, respecting the person's capacity to swallow. Introduce the dishes in the order asked by the user. Also, encourage the user to do some of the actions by herself according to capacity. Initiating the motion and showing the utensils from a little further away are good ways to help the user retain certain abilities. People with trouble swallowing should not be given citrus juices, as acidic juices increase the risk of choking, which can cause serious damage to the lungs. Do not incite the person to speak when chewing, and if necessary, lift the chin to keep the head as straight as possible.
Are you still hungry? You are? Perfect. Okay. Is that enough? That's good?
Yeah.
You're full? Perfect.
At the end of the meal, the PSW wipes the user's mouth and hands, removes the bib and the tray, putting them in their appropriate receptacles. She makes sure the person remains seated upright for at least 30 minutes after the meal.